dear students. Myself, Dr. Junaidul Amin. I welcome all of you to my YouTube channel. Please do subscribe and hit the bell icon for latest updates. Today, we are going to discuss about the topic urinary tract infection, which is the most important topic for your exams and for clinical practice also. The urinary tract infections involve urinary bladder, and second thing, it involves kidneys. When it involves urinary bladder, it causes something known as cystitis. What do you mean by cystitis, sir? Cystitis means inflammation of the urinary bladder, and when it involves the kidneys, it causes pyelonephritis, which means inflammation of the kidneys. The urinary tract infections are more common in females than males. What is the reason for that? The reason for that is there's a shorter urethra in females than males. Sir, if there is a shorter urethra in females than males, why is it significant? It is significant because suppose this is the bacteria, it gains entry into the shorter urethra in a very short span of time, so that it causes UTI. I hope you understand that. Now, what are the sources of infection? The sources for infection are, the first source is feces. Feces are the most important source of UTI. In feces, there is a bacteria. The name of the bacteria is E. coli, which is responsible for almost 90% of the UTI. And the second source of infection is sexual activity. The third source of the infection is incontinence. The fourth source of the infection is poor hygiene of the patient. Now, there is a thing called as catheter associated UTI. Which is caused by urinary catheters. The thing with this catheter associated UTI is that it's more significant and it's challenging to treat. Okay, now we will discuss about what are the symptoms of the infection UTI. What are the symptoms of the UTI? The symptoms of the UTI is, first symptom is dysuria. What do you mean by dysuria? Dysuria means pain or stinging or burning sensation during micturition. The second symptom is suprapubic pain or discomfort. The third symptom is frequency. Next symptom is urgency. The next symptom is incontinence, and Next symptom is hematuria, which you might be knowing is blood in urine. The next symptom is cloudy or foul smelling urine. The the next symptom is confusion, but this symptom is mostly associated with old age population. I hope you understood the symptoms. Let me revise the symptoms once again. The symptoms are dysuria, suprapubic pain or discomfort, frequency, urgency, incontinence, hematuria, cloudy or foul smelling urine, and confusion. Now, moving on to the next part of the topic, that is that's a tip for you guys. You have to remember that the tip is that there's a thing called as in pyelonephrites. In pyelonephrites, when actually this pyelonephritis is really serious, it's a really serious thing, and it is associated with serious complications. Sir, what are the complications associated with it? The complications associated with pyelonephritis are, first thing is sepsis, and the second thing is kidney scarring. Remember this. Okay. And sir, if there is a pyelonephritis, are there any separate symptoms for that? The specific symptoms for pyelonephritis are, first symptom is there will be fever. The second symptom is there will be loin or back pain. The third symptom of pyelonephritis is there will be nausea or vomiting. And the fourth symptom which we find during the examination of the patient is renal angle tenderness. Renal angle tenderness. Remember the symptoms because this is really important. Fever, sorry for that. Fever, loin or back pain, nausea or vomiting, renal angle tenderness. So I hope you understand uh, up to the pyelonephritis part. Now remains causes, lab investigations, treatment, and there's a thing called as pregnancy associated UTI, which will be discussed in the part 2 of the video. Thank you for watching my video. If you are having any doubt, feel free to comment down below. Take care. Goodbye.